Hey guys, welcome back to Medical Coding with Blue. Today's topic is what to expect when you are a brand new coder. Okay, the most important thing, and I'm going to start with the preface with this, okay, is your attitude, okay? The only thing that you can control here in the scenario when you have gotten your credential, you've got your first job, the only thing that you can control is your attitude and your response to how things are happening around you, okay? Now, I will tell you this. It is scary. You're going to feel like you don't know what you're doing. You're going to feel like some days you're like, what the heck did I get myself into? And then there are going to be other days in the beginning when you're like, I am exactly where I need to be. I know exactly what I'm doing. I am so glad I did this for myself. I'm so glad I did this for many reasons, or for my family, or for whatever the reason that you got into this for. There are going to be days when you feel like that. And those are the days you got to really hold on to, especially on those days when you feel like, gosh, what the heck did I get myself into? Okay? So, here's the thing. You have to prepare yourself as best you can. It is impossible to think of every different kind of scenario you're going to come into when you're first getting into your first job. The most important thing is not to overthink and to go with the flow. If your supervisor or your lead tells you that they want to put you in a certain clinic or whatever, do not fight them. Just go with it and say, okay, I will do this. I will work with you. If you get stuck, or if you find yourself that it's you're having a hard time grasping whatever clinic it is, make sure that you're doing your research before you go and ask. Don't just say, I don't get this. Google. Okay, go through the different websites, anything that will help you, anything and everything. I do have a video out called Helpful Websites for Medical Coders. I'm going to link that in the description box below, so that way you guys can arm yourselves with that. This first job is going to also highlight the things that you aren't so strong in, okay? Especially when you get your first audit. And a lot of times you will go through a process in the beginning before they just turn you loose, okay? Some facilities will have it where you are supposed to be coding a certain amount, and the lead or the supervisor is going to go over each and every one of them with a fine-tooth comb to make sure you picked up everything like you're supposed to, and that your accuracy is where it needs to be. They usually have a threshold of accuracy when you first start, because they want to make sure that you are grasping everything. If this is your first job and maybe you didn't get a chance to go to a school, maybe you learned on your own, or you had some on-the-job training, but this is actually your first job with a credential, congratulations. But they're going to expect you to already know how to code when you walk in the door, especially when you have that credential in your hand. There are many places, if not 95% of the places that you go, they will not train you on how to code. Now, they may train you on some of the nuances, okay? But for the most part, you're going to have to know how to code already. And they're going to expect you to know this because you passed your certification exam and you have your credential. So they're going to expect you to know how to do these things. They will train you on like how to use their software, because not everybody uses the same software, okay? Which would be really helpful, right? But not everybody uses the same software. There's different companies out there. There's so many different ones, and I won't name them, but there are many different software that they use in different facilities, okay? So learning how to use the encoder is very important. I have a video about the encoder, which I will tag in the description box, just to give you sort of run through on how it looks. Like I said, every place is different, but do not get discouraged, okay? Above all else, don't get discouraged. You're meant to be there. You are meant to be there just like everybody else. And yes, well, we were all new at one time. It is okay to ask questions. Make sure that you are showing respect to the other coders that you are asking questions to and taking notes. I've talked about this before. I've had to train many new people, okay? And I love doing training. I have no problems doing training at all. You may encounter some coders, some veteran coders who do not like to train, who don't want to train, and they will be clear about that because nobody trained them. So, why do they need to train anybody else? Personally, I think that's the wrong attitude to have, but that's just me. I would rather somebody come to me and say, hey, I'm really lost. Can you help me? Sure, I'll help you because we were all new at one time. However, there's a little caveat to that, okay? I do expect something in return. I expect you to have already done your research. I expect you to be taking notes because if I'm explaining something to you, now, of course, there's going to be some times when you're going to have things explained a couple of times to take a couple of runs at it so that you can grasp what's going on. And that's understandable, okay? Nobody's saying, hey, you got to get it the first time. No. Hear what I'm saying, okay? If you have to have something explained twice, at least show that you are taking notes. Because as I've said, I've had people who will ask me a question and I see them and I answer them, but they're not taking notes. They go back to their desk and they come back to me and they say, well, I don't get it. I forgot. Okay, and I'll explain it another time. Again, a different way. Same thing. And they go back to their desk and they come back. Okay, I just don't know how to do this. Okay, now you haven't done what you're supposed to do, which is take notes, okay? You're not showing me that you're trying, okay? And that's the big thing because remember, you still have to prove your worth, okay? You have to prove that you're worthy to be there in being a coder because they're going to look at you when you first walk in and they are going to expect a lot out of you, okay? And as long as you're meeting them halfway, that's all you need, okay? As long as you know you've tried and you're trying, okay, you're actively trying, you're doing your research before you go and ask them. And don't say, well, I don't need help, I got it. If you need help, talk, okay? Communicate and say, yes, I need help, okay? If somebody's offering you help, take it, okay? But if you're showing that you're trying and then you just can't understand it or you can't get it, that's okay to go and ask. Then you can say, hey, I've looked over this. I went to this website. I looked in this book or whatever. And it says this, this, and this. But I don't quite understand. Can you help me? Then that's acceptable, okay? But like I said, don't be so stubborn if somebody sees you struggling and they go to try to help you, okay? Because I know a lot of ego gets played in the beginning, okay? And that I see a lot too. Especially when I train somebody that's new. You see the ones that are like really grateful and like, oh my gosh, thank you so much for helping me. And then you see the other ones that want to get stubborn and say, oh, well, no, I know. And then they fall flat because, they're struggling and they don't need to. Okay. And don't feel like you're stupid or that you don't know, or you feel, I don't want to feel dumb if I ask this question. There's no such thing as a dumb question. And especially when it comes to doing medical coding, we work with patient information. We work with medical records, okay? What we select, those diagnoses, those procedure codes, they follow the patient. Not only that, the patient has to pay for what the services that were provided to them. If that record is coded incorrectly, guess what happens? That patient either has to pay out more money than they need to, or they have to pay out less money than they should because the doctor's work is worth a lot more than the code that was picked up. Now I get it, we're all human and there's going to be times when you select a wrong code and it'll come back and like, oops, that was my mistake, that was my bad, and let's go ahead and correct it. But you have to be careful and you have to make sure that you're at least understanding what's going on, okay? I'm not saying this to overwhelm anybody, okay? But I am telling you what to expect, okay? Because a lot of times people get these credentials and then they get their first job and they're like, whoa, oh shoot, nobody told me about this. Nobody said that this is what was going to happen, okay? I'm not here to sell you medical coding as a career or profession. I'm not here to sell it to you, okay? I'm not here to discourage you either. I am here to be as real with you as possible. This is what you're going to encounter. This is what you can expect, okay? You can expect these things, but it's all going to depend on how you handle it, okay? Now, in the beginning, when I got my first audit, and it was just like, okay, well, my auditor was like, okay, on your evaluation in management, you have to remember that in order for it to be a complete history, you have to have all three on your P-fish. And if it's missing the family history or something else, then it's not a complete past family social history. And I'm like, oh, oops. And so I was in that time when they were auditing 100% of what I was touching, and they were like, okay, that's the only thing that you missed. And if the provider had documented all three of these, it would have been a higher level. But we had to kick it down one level because they didn't meet that full criteria of a complete past family social history. So I was like, oh, and that was something that I learned right then and there. And then moving on in my other jobs, I was able to learn other little things about combination codes. Those darn combination codes. It's like, ah! When I first encountered chronic hypertension and chronic kidney disease, okay, back in the day, when I got hit on an audit with that, I was like, oh, shoot. And I had learned about it when I was taking my course, but I had forgotten about it, and then I had selected it. I had done each individual one instead of using the combination code like I was supposed to. So I was like, oh well. But I never made the same mistake again. And that's the thing. When you are getting your audits and things like that, learn from your mistakes. Learn from the things that you are being counted as wrong, okay? Now, a good auditor will tell you why you were wrong, and they'll show you a good resource and things like that. If they're not telling you, like with a resource, at least have them explain to you why it's wrong, okay? Or if they tell you, well, this is wrong, and they tell you why they counted it as wrong, go back later on. If you feel like they won't explain it, go back later on and go through material, an E&M book, or go to E&M University and check it out, or go to a website that explains whatever diagnosis you got wrong. Or if it's a procedure code, type in the procedure code into the internet and see what the internet pops up with, or get a book and check it out and find out what was wrong with what you coded or what you selected. Or go back to the CPT book and look at it in that particular section, whatever is throwing you, okay? Those are the things that you have to do. And you're going to do that a lot in the beginning, okay? And there's going to be times when you're sitting there all day, even with the medical dictionary, because you're like, okay, what the heck does this mean? Or with the abbreviations book, like, I don't understand what this abbreviation is. And it's so dangerous. And I always caution my providers not to do this, because we have an approved list at my facility of medical abbreviations, and if they deviate from this list, I'm like, this is the problem with this. When you deviate from this list, this could be a myriad of things, okay? And I need you to make sure that you are following this list, because otherwise I could interpret it as something different from what you're actually documenting. Okay, so that is another thing to watch out for, okay? But like I said, it is okay to reach out to your coworkers, but make sure that you are asking and showing that you are trying, okay? Because like I said, there's going to be those days when you're going to be like, oh my gosh, I don't know if this is for me. It is, okay? You're just going through that shaping portion, right, of being a new medical coder. Now it takes us a while sometimes, and depending on what your background is too. Do you have a background already in medical? And if you don't, that's okay. I didn't have background in medical at all when I first started. I knew nothing about medical. I was so far away from the medical field, it wasn't even funny, okay? And I have many videos out where I talk about how I got into medical coding. And I always say, medical coding found me. It was not the other way around. I did not go out and seek it. I didn't even know what this was when I first started. But I'm here now, and I like to share the things that I know, because I wish this was stuff that people would have told me in the very beginning so that I could have been prepared, okay? So you're lucky in that you're here, you're doing research. So I think that's wonderful. If you are here and you're doing research and you're like, well, what is this medical coding all about? Or gosh, I'm a new medical coder and I don't know what to do. And you're here and you're watching this video. Thank you. I am so glad you're here, because this tells me as a veteran medical coder that you're going to do great. You know why? Because you're doing your research and you're taking the time to look into all these other avenues of, about medical coding. So much of like these schools that teach medical coding and things like that, or if you're going to trade school, a lot of times it's self-paced. If you're learning online, you're also doing a self-paced program. You're learning on your own. That is the vast majority of us that are medical coders. We learned on our own, okay? I learned on my own. I went through a self-paced program at a trade school, okay? And I had maybe a seminar maybe a couple times a week, maybe if that, where a veteran medical coder would come in and teach a class or whatever. And at the time, I didn't know. I mean, I didn't know about half of this stuff. I didn't know, like what do you do and how do you form a query and how do you talk to doctors and how do you behave in a meeting? How do you dress for success? I've always been very fashion forward. But, making sure that I was always professional dress. I always make sure that I'm very presentable. You will not catch me in jeans at work because I think that jeans at work is inappropriate. Sometimes they do have jeans day where they have it specifically designated for that day, and that's totally fine. And I'm totally fine with doing that. But when you are in a professional work environment, you do have to carry yourself professionally. You want people to take you seriously, you need to look the part, okay? Because I have seen many coders who walk in, and these are brand new people too, walk in with jeans and a t-shirt like they're gonna go to a concert. I'm like, where are you going? Oh, well, I'm a new coder, and and I'm looking at them like, you've got this wild hair that is not a natural hair color. Now there's nothing wrong, okay, with wild hair color. There's a time and a place for it, okay? But when you're in a professional environment, it is not the time or place for it, okay? Now, other people may disagree. You may disagree with what I just said, and it's totally fine. But I'm telling you, these are the steps for success. If you want to set yourself up for success, this is something that you should consider, okay? I have a great deal of respect for my providers. They have a great deal of respect for me. Why? It is a mutual relationship. I do not go in there like I'm going to go to a concert. I do not go in there with a trash mouth way of talking. I am very professional when I'm speaking with them. I address them as sir or ma'am. Very rarely will I call them anything else other than Dr. So-and-so or Dr. this or Dr. that. My PAs, I'll even refer to them as Mr. or Miss, whatever they choose to be called. I will ask them sometimes, what would you like to be called? How should I refer to you, sir or ma'am? If they want to get more off that very formal and they want to be maybe semi-formal or whatever. Okay, so these are just some of the things that I just wanted to kind of share today because I know that it is overwhelming in the beginning. Trust me. I know. I know I've been the new person. I've been the new coder more than a few times. And I know. And with my current facility, I've been bounced around a lot of different clinics. I've had exposure to a lot of different providers. Why? Because I am not afraid. And that is something that my supervisor notices as well. I've had 3 supervisors, and 2 of those supervisors recognize that I am very fearless when it comes to different clinics, that I am totally open to coding clinics that are considered harder because I need that. I need the challenge, okay? I need the challenge of being able to have something that can stretch my mind and I can, move forward and do great things, and I've had really good supervisors, the 2 that I'm talking about. I've had them where they know that I cannot be micromanaged. I had one supervisor that did micromanage me, and it did not turn out well because I cannot be micromanaged. That is just something that makes me very stressed. And when I get stressed, it's very hard for me to be at my full potential. I have to have that flexibility, and I'm very responsible with it. I'm very responsible with the fact that I had the 2 supervisors that were very, well, of the 2, I have 1 now, that she understands it. I mean, my supervisor, she gets it. She knows that I have to have that flexibility to be able to do things creatively in order for my providers to benefit and for other coders to benefit, because I do assist other coders and I don't have a problem with it. I don't have a problem stopping in my day and assisting somebody. But that's me, and you're not always going to be able to encounter that, okay? So if you happen to be in a place where it's not that way and you need help, you can reach out to my channel and ask me. It's totally fine. I always include my email address. I have an Instagram at Medicalcodingwithbleu, all one word. And you can reach me there as well. So, or you can comment on any of my videos. I'm very responsive. I may have times where I don't get back to you like right that instant because of signal or whatever. But for the most part, I do respond right away. My channel is enough in its infancy still that I can do that, you know. So again, if you have any questions, just reach out and say, hey, this doesn't make sense. And I would rather be the one to help and explain than see somebody struggle and then maybe decide to give up on medical coding and be like, this isn't for me, because of what they were experiencing around them. If they weren't experiencing that support or whatever, and they're just like, oh, I'm just gonna give up on it. Because you never know, if you're throwing away that potential, or if you're just throwing away all the time you spend in school and all the time you spend away from your family studying, or you know, whatever, or you're putting your pause on your social life, or maybe with your significant other, you know, just to try this and then just to give up. You know, to me, it's just like, why would you do that? You know, don't do that. Don't give up. Whatever you do, don't give up. And don't be hard on yourself, okay? Because we were all there at one time. Just invest a little bit more time. If something is throwing you, that's okay. Invest a little bit more time in it. I talked about when I was in school that evaluation and management was something that everybody was struggling with in school. And they warned me. They said, you know, people are failing this portion of the course and then they're just dropping out, some of them, because they can't get past this evaluation and management part. So I was like, oh, okay, well, I'm not going to slow down, because I was going through at a pretty good pace in the school. And I said, you know what, I'm going to read that book cover to cover. So I literally, the book was about that thick. And I talk about it all the time, that I read that book cover to cover. I had to. Even though we just had to do certain sections in that book, I still read that book cover to cover. And that's why it's a little bit easier for me now, more than some people, to do and explain evaluation and management, because I did that, you know. And I am starting to incorporate evaluation and management into the quizzes. I will start doing some scenarios where I'm like writing it out and we can dissect it and things like that. But those things take time, because you got to make sure that you're doing it right. And this would mean I have to author it. I have to author the whole thing, because, again, these are made-up scenarios. You know, I can't just take these, you know. I have to make these up. So just give me some time and I will do that for you guys. So, but yes, this is my take on what to expect when you're a brand new coder. Okay? So if you do have your first job as a medical coder, congratulations, okay? Stick with it, and it will get easier as long as you invest yourself in it, and as long as you take the time to learn it and be patient with yourself. You'll be okay. All right, so I will go ahead and close this up. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. All right, I will see y'all on the next video. Bye.